Hey guys, so today we're making another specialty video for our friend Steve. So Steve is from Thailand. He was in the clinic not too long ago. He's having severe back spasms and pain that was radiating down his leg. So when he went back home, he got an MRI done and it showed that he was having facet problems in his L4, L5 joint. So what that means is in his spine is where we're specifically talking about facet joints. Now, facet joint, we're talking about cartilage that are in between joints. So specifically in this case, we're speaking about the discs as well as the cartilage so that your spine can move and be nice and flexible. Now, this is most commonly caused from a disorder called disc degenerative disorder. So what this is in most cases is as we get older and as we become a little bit more unhealthy and things like that, our discs are unable to hold the fluid to become nice and spongy and to absorb lots of that impact. So for some of us, as we get older, our spine ends up getting into a lot of problem and radiating pain throughout the body. So as a result, with all this compression, you can build up some calcium, and then that could lead into arthritis and things of that nature. And then, of course, if it's left untreated, it can get into a severe case of spinal stenosis, where it starts to narrow in the canal of the spinal cord itself and cause lots of problems. So for this video, we're going to show an exercise and a couple stretches to really help the facet joints to strengthen. Alright, so the first thing that we want to do is try to open up the facet joint itself. So his problem is in his L4, L5 joint, which means it's really, really low into the spinal cord itself. So what we want to do is we want to go on our hands and knees. I want to make sure that your knees are stacked right underneath your hips, shoulder width apart or hip width apart, and same with your hands, they'll be shoulder width apart, and again stacked right underneath your shoulders as well. Now you don't want to cock your knees out whenever you're doing this, you want to keep it nice and straight. And all we're basically going to do is try and keep a neutral spine, keep your feet flat onto the ground here. We're going to push right back and try to really stretch out and open the lumbar spine and just come back and forward. You can hold it for 5 seconds on the way down here and then come back up to neutral. You don't want to come and go forward and start compressing your lower spine. You just want to stop neutral and then go back again. And again, if you cock your knees out like this and you go, you're actually just squeezing your SI joints right here as you're coming down, and it's going to cause a little bit more pain, so you want to stay nice and straight. So when we get to the point where we're going to be strengthening the spine and increasing some of that mobility, we're going to do an exercise called, commonly known as like a Cobra. So your hands are going to be stacked underneath your shoulders, and you're just basically going to be lifting up from the chest, trying to keep your waist down, and exercising the spine and putting it through the motion. Now it's important here that you're actually pushing with your hands to lift it and curl the spine, and not actually curling with your back muscles and causing more compression and pain to the back. Next we're going to move into lumbar and IT band stretch. So in order to do that, we're just going to lay on our back. We're going to cross one leg over the other. You want to try and keep your foot above your knee or at your knee level. You don't want it way down here. So nice and high, you're going to grip onto the outside of your knee. Keep your other hand out for stability, and you're just going to try to twist as much as you can to the side. Try bringing your knee all the way down to the floor on the other side here. One of the key important things is to make sure that your upper back and your shoulders are against the mat, so you're not here and twisting and lifting up everything. We're staying in neutral spine still, and then twisting through the lower back. Last thing you can do is that if you have a chin-up bar at home, or if you have a doorway that you can dangle on, just put both your hands up above your head and then just lower your back down nice and slowly, just taking the compression off of your spine. That should help relieve a lot of the pain and help gain some mobility back in your spine. If you have any other questions about facet joint problems or how to mobilize your spine, give us a call or a message and we'll be sure to respond.